Hey guys, this is David again, and I'm bringing you another stock that I kind of like at this time. I think the stock is ready to buy at this time. I bought it a long time ago, and maybe it wasn't ready to be bought at that time. It went through a reverse split, which kind of hurt me, but I think at this time it's ready to go, and I'm going to talk a little bit about it. The company is Ritter Pharmaceuticals. The letters are RTTR, and it is a company that is working on lactose intolerance. The company currently has the medication in phase 3 studies for the lactose intolerance, and that started, I believe, in June of this year. And at this point, we should be getting some results, hopefully soon. The first 2 studies they did show very good results, and that is why I initially invested in it. I also invested in it because as a doctor, I know that lactose intolerance is a problem. I know that I have a little bit of lactose intolerance. In fact, it's got me to the point sometimes that thought I was dying. It was so bad, but the pain is severe, the bloatiness is severe for some patients, and it really prohibits them from drinking milk products and eating dairy products. And if we can treat them and know that their symptoms are going to be gone without them having to take lactate or something else, then I think it's going to be very beneficial. I think doctors will use the medication a lot, and I assume that if they approve this medication, that there's probably going to be questionnaires that are going to be used in clinics to see if people have lactose intolerance, and if they do, then we're going to treat them. The treatment is really easy. I think it's a 28-day treatment, and after that, that's all. The medication increases the bacteria that breaks down lactose, and therefore you don't have the symptoms of the bloatedness and all the after effects of being intolerant to lactose. So in that sense, I think that it's going to be very well worth it. The problem, I guess, is this company is only dealing with the one medication, and if it fails, then you're going to do bad. However, from all signs, it looks like this company is going to do well with this medication. I don't know how much long term I would keep the stock after it does get approved, if it does get approved, and it does well in this phase 3 study. But I think initially, for now, I see it as possibly doing well in phase 3, and I see if it does well in phase 3, then I don't think the FDA would not approve the medication. And so we'll see about that. The company is not currently under any risk of going or undergoing another reverse split, and I think the price at this time is $1.85, and hopefully there's a lot of upside to the company at this time. Once again, I'm not a financial advisor. I am a doctor. I deal with these. I like to research on these new medications that are coming out, and that's why I talk about these, and I try to invest only into the ones that I think have good potential of being used, and that possibly if they were coming out as new medications, I would be using with my patients. And so that's why I try to divulge this information to you guys. I will talk to you next time. Take care.